Hello and welcome to Tea Time with me, Dr. Casey. I'm joined today by the wonderful Dr. Patrick Fratellone. Hi, Dr. Fratellone. It's wonderful to see you.
Hello, how are you?
Good. How are you?
Oh, home after a long day of work.
Well, thank you for taking the time to have a cup of tea with me.
Yeah, I have mine here too.
Wonderful. So we're going to do a little bit of a different format today, and I'm just going to go right ahead and introduce you, and then we'll get talking about tea.
Good.
Dr. Fratellone, I know Dr. Fratellone from my medical school experience. He was a classroom and a clinical teacher, and he is a wonderful, wonderful doctor and healer. So Dr. Fratellone is a medical doctor. He's a registered herbalist. He's a fellow of the American College of Cardiology, and he completed a fellowship in integrative medicine. He's been practicing clinical medicine for over 25 years with practices in Manhattan and Fairfield, Connecticut. He was the chief of medicine and director of cardiology at the Atkins Center for Complementary Medicine, and he has held positions as medical director of the Fifth Avenue Comprehensive Medical Group and regional director of cardiology programs for the Ultrasound Diagnostic Schools. So it's safe to say he's a cardiology expert, really, in many ways. And he's also been an adjunct professor at the University of Bridgeport College of Naturopathic Medicine since 2014. And he's a board member of the American Apitherapy Society. And he's authored many books and journal articles, and he is just brilliant. And I'm really grateful to have learned from him in the classroom and clinical settings, and just wonderful healer. So Dr. Fratellone, let's talk about tea.
Oh, I love tea.
All right.
Well, it's interesting. When you listen to what people say about you, say, my God, I did a lot in my career. But the greatest accomplishment, I think, was when I did a fellowship with Andrew Weil in Arizona, because I was introduced to, and you know her because I think you heard her speak, with Tiarona Lodog. And she's a MD also and an herbalist. She was a midwife first. And while we were going through the program there, when we were in Arizona, she said to me, I think you should study herbs. Because in the fellowship, they do homeopathy, acupuncture, counter strain, all these different aspects of medicine. And she said, I think you'd be great learning herbs, because I really liked it. And I said, okay. And I said, well, when I graduate, what do I do? And she said, I think you should do an herbal course. So I did an herbal course with Seven Song, who is an herbalist in Ithaca. And from then on, it's been nothing but pleasure. I got accepted by the American Herbal Guild, which they don't accept a lot of MDs. And I'm actually lecturing, doing their next conference, their conference in October, Zoom wise. But the greatest accomplishment for me was teaching you guys about herbs and heart disease, herbs and cancer, and just general herbs. And I just love herbs. And, I do a lot of tea blends and a lot of tinctures. So yeah, it's a subject other than cardiology I love to talk about.
And there's so much wisdom in plants and in nature, really. There's so much innate wisdom in the body. There's really, I think, a synergy if we can kind of find the right plant or herbal fit that can help support someone, and having that rich depth of experience and expertise in medicine really probably allows you to be much more thoughtful with the herbal choices with all of the knowledge you have with herbs.
I'll give you an example today. A lady had interstitial cystitis, which is, we don't really know the cause. And she said, do you think you can make me a tea for it? And, I said, well, if I have certain, I said, let me go inside. And I went inside our little tea apothecary, and I mixed uva ursi, but I mixed creativa, which is an interesting herb because it's not used a lot and they don't use it a lot. And creativa is an herb which tightens up the urinary bladder, which is exactly what you want with interstitial cystitis. So I think there's not one single herb for a disease. And I have to say that because everyone thinks, oh, one herb, one disease. And in homeopathy, one homeopathic medicine for one disease. And I rather use blends. Because I don't think someone says, oh, what would you give for, let's say, herpes? And people think of maybe lemon balm, automatically. I could think of 5 herbs that I can make into a tea blend or a tincture. And why I like tea better than tinctures is that every tincture most of the time has to be an alcohol base. And it could be in a glycerin base. And since I'm sober from alcohol, I feel bad making tinctures because a lot of my patients are sober and they'd rather have a cup of tea. And I think a cup of tea is so, I don't know, it's so old age. It's so like, you know, it's kitschy. It's nice to sit down and talk. I just think teas are so much better. And plus they're better absorbed because they're liquid rather than a tincture because you have to absorb the alcohol, the glycerin.
And there's like a ritual around having a tea, like, you know, it's almost like connecting you maybe with the past in a sense, because all of these tea traditions have been passed down many, many years.
Well, it's so funny. So I learned to drink tea. I was always a tea drinker, but when I went to medical school in England, when we were in our fellowship clerkships we have, and we would say it was a surgical rotation or an infectious disease road, whatever it was, 4 o'clock, everything stopped in England. They literally made time for tea. In between surgery stopped, clinic stopped. It was amazing. But they're interesting. Not that they ruined the tea, but they put milk. They brew it with the milk.
Oh, it's brewed with the milk.
Yeah, it's kind of weird.
Okay.
I just never got it. And if you didn't like dairy, you know, it didn't really go for you. Where I rather have tea without milk, maybe no sugar. I'll add honey all the time, but definitely no sugar. But it's a tradition that they have. They prepare the tea, automatically the milk, and they steep the tea with milk.
Huh.
Interesting, right?
All right. All right. Well, actually, let me just play my little tea music right now.
Okay.
All right, that's our tea time music. So I was perusing your website because you have this beautiful, beautiful creation of teas, Botanical Bounty, and also some physician grade supplements, part of that Botanical Bounty line that your son has created with you. Is that right?
Yeah. So Gregory took some courses. He really is trained to be a primatologist, but he fell ill to Lyme disease and he didn't go back to study that for a while. So he said, why don't you help me create a tea company? And we created Botanical Bounty, and we named it that, interesting, of a patient of mine who was named Barbara B, who she drank a lot of tea. And when she passed away 5 years ago, I said to Gregory, could we think of a name that involves her initials? And we came up with Botanical Bounty. So it's in honor of Barbara. And we always had tea. I mean, I went over her house every Saturday or Sunday morning, and she would always, have a brew nice tea, not English breakfast all the time. She always went for herbal teas. And, there's a lot on the market with herbal teas, but as you said, I like to make my own. So we carry stock teas by different variety of companies, Mountain Rose being one of them. And then I blend them. So some blends are already mixed, and some blends, like today, this female patient, interstitial cystitis, I came up with a tea that I just went in there and looked. The blends that we commonly use that are already pre-mixed would be something for the stomach, something for the heart, something for inflammation. But I would say 9 out of 10 people leave the office with a paper bag of tea, already pre-mixed, and then some that I make right there. And I think it's just a nice way to just tell patients, if you could pre-mix the tea, if you can make a tea right with them there, it tells them that you're listening to their symptoms. In my mind, I'm going through a swirl of different ones, and I'll just come up with a blend that's right for them.
And that's beautiful individualized medicine also.
And what we also do, on their website, on their botanical website, you could put in your symptoms and I'll make you a tea. So you could go online and put in how many symptoms, 10, and I will make a tea without even meeting you, just based on your symptoms.
You do that for anyone?
Anyone. And no two teas will be alike. And that's beautiful. That's a nice way.
Go ahead.
I would love to do that. I mean, I would like to have a huge company where there's a warehouse that everyone's getting symptoms, but then of course you need an ND or an herbalist to go through them. But we get about maybe 3 or 4 a week on those. But most people want the blends that are already made because they tried them in the office. And we do serve tea in the office.
Oh, beautiful.
Yeah.
Beautiful. And so I was looking at your different tea blends, and I like the plants are all kind of like they're friends, right?
Yeah, they're our friends.
And
Yeah.
I was especially drawn toward the lovely blend for the heart.
Yeah.
I
So
love some
that's,
of those herbs.
yeah, I
Especially.
think that's a very special tea. You know, there's hibiscus. I believe there's there's hibiscus,
You have
ginkgo,
motherwort.
motherwort. Well,
I love
motherwort, you know,
motherwort.
motherwort. You know, motherwort's a special herb for me because I was on that since I was a kid when I had heart disease. I had a congenital heart disease, and I was on motherwort plus digoxin plus blooming cactus, night blooming cactus. But motherwort it is part of the mint family, which a lot of people don't know. It's Leonorchis cardica, which is the name, and it has a very pretty flower. And it was originally named for nursing mothers. And that's how it got its name. But if you listen to Culpeper, who's a famous old herbalist, or Sawyer, they talk about it in their books as helping the toning of the heart. So it's good for palpitations, it's good for anxiety. A lot of motherwort in my practice is used besides atrial arrhythmias or rhythms from the heart. I use it for an overactive thyroid. Because it's great to calm down the palpitations when your thyroid is acting up. So I like it in a tea, especially for the heart. Now, hibiscus acts like a cardiac medicine we have called ACE inhibitors. So hibiscus is great for blood pressure. But the tea is generally designed not just for blood pressure. Oh, you went away. You there now?
Oh,
yep. Sorry. It's not just designed for blood pressure. It's designed just for a general toning aspect of the heart. So that's good.
And the hibiscus also supports the kidney health, right? And that's
correct.
So tied
Yes.
to blood pressure and
yes, it does. So hibiscus is a great herb. And what else is I didn't even remember sometimes what I put in it, but motherwort,
you
hibiscus.
also have hawthorn and horse chestnut.
Yeah, so hawthorn, I think that most people know that's great for the heart. We don't put a lot of hawthorn. When you look at the ingredients, I think hawthorn's third on the list, which means the concentration, when you make a tea blend, whatever is the first ingredient is the most. So in this case, it would be hibiscus. If hawthorn is third, then it's the third most. So it's not a lot because you have to be careful with hawthorn if the person is on a cardiac medication. And horse chestnut is good for the venous side of the heart. So I think it's a great, and to tell you the truth, it tastes good. And you want to make a tea blend that tastes good, because if I would have put artichoke in there, the tea would have been bitter. You know that. And who's going to drink a bitter tea? Let's face it, no one is. So I'm glad that I did no bitters in there, no artichoke, no ginkgo, because that would have been kind of bitter too. So I try to make the tea a little flavor, have a little flavor in it.
Yeah, it sounds really beautiful.
And it's a big seller because a lot of people that they might have heart disease in the family and they just want a nice cup of tea. And a lot of patients who want to get off blood pressure medicine use it, and they use it 1 to 3 cups a day. Now, if they're trying to get off blood pressure medicine, I would ask them to steep it a little longer, because I don't like, so usually I have them steep it for like 5 minutes, but if they're using it to get off blood pressure, I would have them steep it for 10 to 15 minutes to make it stronger.
And would you cover it in that case also?
Oh, yeah. I like, so when I make tea, I love cups that have the strainer in with the cover on top.
Yeah, those are nice.
Because those are the best ones to use, because this way, you're keeping all the heat in.
Yeah, especially with the loose tea like this, because your tea is so, you're blending it and it's not in tea bags. It's freshly made and crafted.
Well, I thought to put it in tea bags. You see the problem? I have see, I tell you, we first used to have the tea sold in tins. And I got away from that because of the metal. Then I wanted tea bags, but then you have to staple the tea bag. That's more metal. So then it came to paper bags, and a non-toxic plastic bag. I mean, you have to do something. The best way to sell it would be in, oh, where'd you go? The best way to sell it would be in glass, but you can't, I mean, that's impossible, you know? So I like it in paper or a non-toxic plastic.
Mm-hmm. Yeah. Yeah. It's the cleanest way. It
Yeah, and
sounds like.
Whole Foods sells a tea. I think it's called Pig Time,
Mhm.
PI, and they have blends. Not their blends are only 2 teas together. Like they'll do licorice and peppermint, or they'll do ginger and lemon. You know, not big blends. Our tea blends are 4 teas or more,
Hmm.
which
Do
I
you
think is
have
good.
do you have a favorite tea for yourself and then
Yeah.
maybe for other people?
So mine is Gutsy. So Gutsy tea is, it's a lot for gut issues, malabsorption, celiac, any of those. And I like it because it contains marshmallow,
Mm.
it contains nettle leaf, it contains and raspberry. Sometimes I put in catnip, but I noticed lately, I don't know why, a lot of people are allergic to catnip, and I don't know why that is. So I sometimes omit the catnip, but marshmallow, slippery elm, raspberry, and nettle leaf, not nettle root.
Okay.
And
Okay.
it has the raspberry, look, I like a tea to have a little fruit flavor. So the raspberry as a tea, and these are all been used for some type of GI ailment, probably never together, but it's the best-selling blend next to Lovely.
Oh, nice. Nice. Yeah, the raspberry's got some nice tannins, probably
Yep.
tightening up some of those junctions and
nettle leaf is great for allergies. It's also great for the
Mhm.
stomach. The marshmallow is the best thing. And slippery elm, so I use the slippery elm. A lot of people, it's fluffy. It comes like little fluffy balls, because a lot of companies put slippery elm in a GI mixture, but I don't like the powder. I rather use the real slippery elm, which is almost, which is really good.
Mm-hmm. Yeah.
Do you use a lot of teas in your practice or not?
I would say not I definitely do, but not as much. And hibiscus is actually one that I will recommend more often. It's one of the teas when I do recommend teas that I'll recommend more, just because it's gentle, but it touches on the cardiovascular tone and kidney support. With teas, I find that compliance can be an issue for people. So it depends on the person as to whether.
Do you think they would be more compliant with the tincture or with teas?
I don't know. I do probably in terms of everything more supplements.
Right.
More food is medicine really, but
Right.
then after that probably capsules.
Okay,
And
but
then
I agree. I think people will take capsules. I'm still
yeah.
debating over the years which I should use, more tea or more tincture, but I'm more comfortable with teas. I mean, tinctures are great, but you can't, I guess like in school, you can mix a tincture right there. The problem is then you have to have a lot of stock bottles of individual herbs, where it's easier to carry bags of tea rather than stock bottles of herbs.
Yeah, yeah, and especially with like the alcohol
Right.
considerations. So
Yeah.
with that, I'll usually almost always tell someone to boil off the alcohol, just for however much they can get boiled off, it'll help them. And then if things are available in glycerite form rather than the
Which is fine.
alcohol, that's a
Yeah.
nice way, but not everything is, and it doesn't last as long.
The only glycerin I still make in tincture form is elderberry, from fresh
Mm,
elderberries. I pick my own elderberries, and I'll make my own syrup from the elderberries.
nice. Do you have an elderberry tree in your yard or bush?
Three.
Awesome. That's
I
awesome.
started. I put them in 3 years ago, and I have a lot of berry bushes in the yard. But I made sure when I moved to Connecticut 3 years ago, I was only using the house on weekends, and I put in 3 elderberry bushes, different kinds, and they're beautiful. And I get enough elderberry from 3 bushes to make 30, 40 bottles of tincture.
Oh, that's amazing.
Yeah.
Now, have you ever made rose hips tincture or rose hips tea, anything with
I
rose?
use rose. Rose hips is interesting because there's a Bach remedy Bach flower, there's rose hip. They have one.
Hmm.
And I like some of the Bach flowers. Rose hip, yes, because of the vitamin C content, it's good. So I would mix it with nettles. See, if I thought of rose hip, I would do more of it with nettle leaf. So someone that has allergies, I would combine ginger, nettles, and rose hip. That would be my.
Nice.
Yeah, that's a good. I
I
should
would
use
like
that
that
more.
tea.
That's a good tea. You're right. That's a good one. I like that one.
What would you call that? You have I love the names you have of
Well,
your tea.
Gregory came up with the names, and
Mm.
everything like lovely, streamly is for urine, achy we use for Lyme disease and arthritis. I don't know what I would call it. That would be interesting. We had sneezy, we use that. We had sneezy and sleepy, or calmly we call it. That's another big T. Nervines, which are used for anxiety and stress, especially in times of this pandemic. I can tell you that we sold a lot of bags of calmly tea. Because everyone, when they think of calm, if you ask the average layperson for sleep and calmness, the first thing that comes to their mind is chamomile. I mean, it does. Even I used to even. I have to tell you, there's so many teas for calming nerves that it's unbelievable. So I decided to make one, but I wanted to use herbs that are not commonly used, like skullcap, which I love. And that's probably one of my favorite herbs. And I combined it with California poppy.
Oh, I love that.
And it really, and I think I might have added a little motherwort in that. But that tea to me, because you needed the skullcap to make it taste good. But there are so many nervines, many more. But I mean, see, in valerian, I don't use in tea form because it's kind of harsh. Plus, people could get a paradoxical response to valerian. So I stay away from the common herbs like valerian and St. John's wort in tea form, only because there are a lot of medicines people could be on, it could interact, and it's just not a great tasting tea. But the combination of California poppy, it's California poppy, lemon balm, and skullcap. It's a beautiful tea.
That sounds very calming.
Yeah, it is calming. And I think people need that today, especially with what we've gone through in the last year.
Definitely. Yeah.
What tea do you drink the most of, do you think?
Definitely green tea.
Okay. I published an article on green tea, and then I did some Christian station about 5 years ago got me to talk about green tea.
Yeah.
And green tea is great, but the problem is the amount that you have to drink to get the effects of green tea is far too many.
Yeah, like the EGCG content.
Yeah, so
they
used to say it was like 12 to 20 cups. They actually brought it down to 8, but still 8 cups of tea in a day is a lot for some people.
Yeah, I find that I get like kind of a benefit in alertness and just warming. But I think everyone responds to nature and to the herbs differently. And I think I just, I am very sensitive to caffeine. Like if I have coffee, it's not going to be good. I'll be jittery and I'll be awake for a long time.
So you get decaffeinated green tea?
No, I'm fine with the caffeine in green tea.
Okay,
but,
good.
In coffee, espresso drinks, and I'm also fine with matcha. It's really the coffee bean for some reason.
So what about black tea? I wonder how you would be with black tea.
I'm okay with black tea, but I will stay up at night if I drink it too late. Yeah.
Okay.
But
see, I like green and white tea.
Yeah.
I mean, the benefits are there. I mean, whether it's cardiovascular, autoimmune, cancer benefits, the benefits are there. I just think you have to drink a lot of it, but it depends. I mean, I'm sure you could drink 3 or 4 cups easily in a day.
Yeah. And, I do pay attention, like you were talking about before, to kind of the sourcing and the quality of the tea. And I really like sencha for green tea.
Oh, okay. Nice to know.
It's a little harder to find at the grocery shops around here, but you can buy it online, and sencha, I think it's one of the green teas that's been studied more, and it has kind of one of the highest amounts of medicinal properties for green tea types. So
see, I like when I was studying in Arizona in the West, a lot of their grocery stores have loose tea to buy,
That's nice.
which they don't have here. Not
Yeah.
even Whole Foods or Trader Joe's has it on the East Coast. It would be nice that people could go in. I mean, there's only, we only have one, I'm trying to even think of the name. There's only one still tea store left in Manhattan that still sells loose teas.
Only one?
Only one. That's it.
How is that possible?
It's amazing. It's called, it's on 8th Avenue on the East Side. Name slipped my mind, but it's only one company, one store. She's been there for 25 years. It's tea. That's it. That's all. But
Wow.
you can't buy loose tea anymore in New York. I don't know why. I don't know if because if the people aren't drinking it, if you don't store it right, you can get mold and stuff like that, but it's not really well.
Yeah. It seems like something that maybe it's, well, I don't know. But being able to buy it online, even though there's always, maybe controversy around buying things online, but if you have a good place to buy it online, then you know that you're getting good
I
quality
mean,
and fresh.
we
And,
sell our, we
stored
sell our
well.
Botanical Bounty ships all over, and we do get a lot of people buying the bags online because it is a nuisance if you had to go buy those individual ingredients and make it yourself.
Yeah, and it's nice that you've crafted them and put the different herbs together to give that synergy and that benefit for people. And do you think with teas, do you think there's any reason that someone should be cautious if they have a lot of health concerns or serious health concerns, or do you think in general teas are kind of gentle enough that someone could start
I think
sampling them?
all teas are gentle enough that anyone could start, even if you're on medication. First of all, no one's going to steep the tea for 25 minutes and really pull out everything. You're going to pour it, you're going to put the water in the cup, and 3 minutes later, you're going to drink it. So there's no harm in it. And teas do not interfere with much of anything. I mean, really. Now, if I know the person is treating blood pressure, then I have a concern because then I'm talking to them already and they're my patient and I'll tell them to steep it for 10 to 15 minutes. But most people drinking tea, no problem at all. I think it's the one of the most benign things that you could offer a patient. And by serving tea in the office, they get to taste it first and they say, I like that tea that I had. What was it? And then they'll buy it.
And will you serve kids tea? What age would you start with tea?
I would start kids at age 6. I mean, I don't think there's any reason not for a kid, especially if it's a fruity tea like hibiscus or an elderberry tea, or you put the raspberry. Kids love that. I mean, that's why they loved glycerin-based tinctures, if especially elderberry, because it's that sweetness they like. But for tea, and you know what I do with tea? You don't have to always drink it hot. I tell people, especially for the summer, if you like the gutsy tea, but you don't want to have it as a hot tea, make a whole quart of it, keep it on the counter, not in the refrigerator, and you could have regular room temperature tea all day long.
And that makes it easy. It's already ready to go.
Correct. And then they want to add their little mint leaves to it, their little honey, whatever you want. But it's so easy to have tea as a lukewarm on the counter.
Now, why would you not put it in the refrigerator?
Well, I don't like teas to be cold. You think about teas, you think of that warming effect on the body. It's different in Chinese medicine, but I would say that I don't want it. You could keep it cold, but not free. I don't want like a cold glass of water. In the morning, I tell people first thing to do, have nice room temperature water, squeeze lemon, squeeze lime, or have apple cider vinegar with the water. I want them to use the tea the same way. But coldness is sometimes too cold for the body is not good.
Yeah, constricting.
Yeah. Look, I think that, if you're in the summer, it's still a nice room temperature tea, add the ice cube, but don't have it in the refrigerator. It's just better that way.
Do you have a favorite herb that you would use in a tea form to gently support immune function?
Well, so, echinacea would be great for that. The thing is, echinacea is overused. So if I had to support immune function, I'd probably do ashwagandha. But single ashwagandha is not great tasting. When you think about it, it's not a great tasting tea. So, I mean, yeah, golden seal, but I think it's used too much golden seal. So I would, immune function. See, I would think of ashwagandha. Gotu kola is okay. Well, you know what's a nice tea that could support immune function? Shashandra berry. Because it's a berry, it's fruity, it supports immune function, and it's a great adaptogenic herb. It's used for many things. And it also is good to boost the morale. So especially right now, if you had one herb to boost morale at time this epidemic, I would use Shashandra berry.
Yeah. And I'm just thinking about the plants you just mentioned, like combining them all. That would be a nice.
Oh no, so that's a
party of
combination.
plants.
Oops, I keep touching that thing. It's a great immune function. If you want immune function, those 4 herbs are great together. Except you have to think about the ashwagandha doesn't really, it doesn't taste great as a tea. But it could be between the echinacea, the golden seal, the ashwagandha would probably be number 4. I'd probably start off with Shashandra berry and put the golden seal echinacea in the middle and save the ashwagandha for the last. And then it would be okay. I mean, there's certain teas that you want, but you have to think about, well, first of all, does it fit the person's personality? Certain teas don't fit personalities very well. So I would say that I mean, if they're buying it online without ever meeting them, that's fine. But if they're going to be in my office and I have to make one, depending on how our meeting goes, I'm going to make it for them. And I want to stay away from those harsher teas for them. It's just a preference.
Yeah, I know that's amazing that you individualize it to that level, but you are certainly benefiting many people with your skills and your healing and your teas. Yeah. Well, this has been a pleasure to connect with you for tea time and to chat. I really appreciate
and we'll do it again, I hope.
Time. That'd be great. I would love to. I'm going to share your website with Botanical Bounty in the notes below, so that anyone who wants to can find you and look at your wonderful teas on there. And I'm going to play a little bit of our tea music as we wrap up. And I just want to
thank you for having me. This was a delight, and I do hope we do it again.
Cheers to you.
Cheers. Thank you, Kathleen. Bye.
Bye.